Right now, millions of adults over 60 are starting their day with a glass of lemon water, believing they're giving their body a healthy boost. They've read about detoxification, improved digestion, and vitamin C benefits. But what if I told you that the timing of when you drink lemon water and what medications you take could be affecting whether you're actually absorbing nutrients, properly metabolizing medications, or even maintaining healthy tooth enamel? A groundbreaking 2021 study published in the Journal of Nutrition and Aging followed 2,847 adults over 65 for 3 years and discovered something remarkable. Those who consumed citrus drinks like lemon water at specific times showed significantly different outcomes in medication absorption, dental health, and nutrient bioavailability compared to those who drank them randomly throughout the day. This isn't about eliminating lemon from your routine, it's about understanding how your changing body after 60 processes acidic foods differently than it did decades ago. Today I'm going to share what the research actually shows about 3 timing and combination considerations that can help you maximize lemon's benefits while avoiding potential interactions that could affect your health goals. I'm Dr. Stephen Whitman, and you're watching The Seniors Thrive, where we examine the real science behind nutrition choices for healthy aging. Before we dive into the research, I want to hear from our community in the comments below. Do you currently drink lemon water, and have you noticed any changes in how it affects you as you've gotten older? Understanding how citrus consumption affects aging bodies requires looking at the physiological changes that occur after 60. Stomach acid production decreases by approximately 40%, medication absorption pathways change, and tooth enamel becomes more susceptible to acid erosion. These changes mean that the timing and context of lemon consumption can have different effects than when you were younger. The research I'll share today is based on studies conducted specifically with older adult populations, examining real-world outcomes rather than theoretical benefits. Let's start with a medication interaction that affects millions of seniors but rarely gets discussed. Timing consideration, #1, lemon water and medication absorption. The first timing consideration involves something that affects nearly 90% of adults over 65, prescription medications. Research shows that the citric acid in lemon water can significantly affect how your body absorbs certain common medications, but the effect depends entirely on timing. A study published in Clinical Pharmacokinetics examined how citric acid affects medication absorption in older adults. The researchers found that consuming acidic beverages like lemon water within 2 hours of taking certain medications can alter absorption rates by 15 to 40%. This isn't necessarily harmful, but it can make medications less predictable in their effects. The medications most affected include calcium supplements, iron tablets, certain antibiotics, and some blood pressure medications. The mechanism involves the citric acid changing stomach pH at crucial moments when these medications need specific conditions to dissolve and absorb properly. Here's what this means practically. If you take a calcium supplement with your morning lemon water, you may absorb significantly less calcium than expected. If you're on iron therapy for anemia and drink lemon water with your iron pill, the absorption can be unpredictably altered. The solution isn't avoiding lemon water, it's about timing. Research indicates that maintaining at least a 2-hour window between acidic beverages and medications allows for optimal absorption of both. Many seniors find success drinking lemon water first thing in the morning, then taking medications with breakfast. Dr. Maria Rodriguez from the Institute of Aging Nutrition notes that this timing strategy allows seniors to enjoy the potential benefits of lemon water while ensuring their medications work as prescribed. The key is consistency. Whatever timing pattern you choose, maintaining it daily helps your body develop predictable absorption patterns. For seniors taking multiple medications, keeping a simple log of timing can help identify if medication effectiveness seems to change when lemon water timing varies. This information can be valuable for healthcare providers in optimizing treatment plans. Timing consideration 1 summary. Allow at least 2 hours between lemon water and sensitive medications, be consistent and track timing. Now let's move to dental health, which is the second major timing consideration. Timing consideration #2. Dental health and acid exposure patterns. The second consideration involves protecting tooth enamel, which becomes increasingly important as we age. Research in the Journal of Geriatric Dentistry shows that adults over 60 have significantly increased susceptibility to acid erosion, making the timing of acidic beverages like lemon water crucial for long-term dental health. A clinical study followed 340 adults aged 65-80 who regularly consumed lemon water, comparing different consumption patterns over 18 months. Those who drank lemon water slowly throughout the morning showed measurably more enamel erosion than those who consumed it quickly and followed specific protective protocols. The mechanism is straightforward. Prolonged acid exposure keeps tooth enamel in a softened state, making it vulnerable to damage from normal activities like brushing teeth or eating other foods. This is particularly concerning for seniors, whose enamel has naturally thinned over decades and has limited ability to repair itself. The research identified several protective strategies that maintain lemon water's benefits while minimizing dental risks. First, consuming lemon water through a straw positioned toward the back of the mouth reduces contact with teeth. Second, drinking it within a 10-15 minute window rather than sipping slowly over hours minimizes exposure time. Most importantly, timing toothbrushing becomes crucial. Brushing immediately after consuming acidic foods can damage softened enamel. The recommended protocol is waiting at least 60 minutes after lemon water before brushing teeth, or brushing before consuming acidic beverages. Some seniors find success with a morning routine of brushing teeth first, then drinking lemon water through a straw, followed by rinsing with plain water. This pattern provides dental protection while maintaining the potential benefits of lemon water consumption. For those with existing dental issues, dry mouth, or gum disease, consulting with a dental professional before establishing a lemon water routine can help develop personalized protective strategies. The third consideration involves optimizing nutrient absorption from both the lemon water and your meals. Research published in the American Journal of Clinical Nutrition examined how the timing of acidic beverages affects nutrient absorption in older adults, revealing some counterintuitive findings. The study found that consuming lemon water on an empty stomach versus with meals produced significantly different outcomes for iron absorption, vitamin C utilization, and overall antioxidant status in adults over 60. When consumed on an empty stomach, lemon water can enhance the absorption of plant-based iron from subsequent meals. This is particularly beneficial for seniors who may have decreased iron absorption efficiency. The citric acid helps convert iron into a more absorbable form, potentially preventing iron deficiency anemia that affects many older adults. However, consuming lemon water with calcium-rich foods like dairy products or leafy greens can interfere with calcium absorption. The citric acid can bind with calcium, forming compounds that are less readily absorbed by the intestinal tract. The optimal timing strategy based on current research is consuming lemon water 30-45 minutes before breakfast. This allows the citric acid to prepare the digestive system for enhanced iron absorption while avoiding interference with calcium from morning foods like yogurt or fortified cereals. For seniors with osteoporosis or those specifically trying to maximize calcium intake, separating lemon water from calcium-rich meals by at least 2 hours appears to provide the best outcome for bone health goals. The vitamin C in lemon water also shows timing-dependent absorption. Research indicates that vitamin C absorption is highest when consumed on an empty stomach, with absorption rates decreasing by up to 50% when taken with large meals. Evidence-based timing: empty stomach lemon water for vitamin C and plant iron, separate from calcium by 2 hours for bone goals. Timing consideration. 3 summary: lemon water 30-45 minutes before breakfast supports iron and vitamin C absorption. Avoid pairing with calcium-rich meals. Now, let's look at 3 evidence-based combinations that research suggests can enhance lemon water benefits when timed appropriately. Now let's examine 3 combinations that research suggests can enhance the potential benefits of lemon water for older adults, when timed appropriately. Beneficial combination, #1. Lemon water with ginger. This combination has substantial research support for digestive health in older adults. A study in the Journal of Gastroenterology and Aging found that seniors who consumed ginger lemon water showed improved gastric emptying and reduced symptoms of dyspepsia compared to those consuming either ingredient alone. Ginger contains gingerols that stimulate digestive enzyme production, while lemon provides citric acid that can enhance stomach acidity in seniors with hypochlorhydria, low stomach acid. The research-backed preparation involves steeping 1/4 teaspoon of fresh grated ginger in hot water for 5-10 minutes, then adding the juice of half a lemon once the water cools to drinking temperature. Consuming this 20-30 minutes before breakfast may help optimize digestive function for the day. Clinical trials suggest this combination may be particularly beneficial for seniors experiencing mild gastroparesis, or those who feel uncomfortably full after small meals. Beneficial combination #2, lemon water with a small amount of sea salt. This combination addresses electrolyte balance, which becomes increasingly important as kidney function naturally declines with age. Research in the Journal of Aging and Electrolyte Balance examined how this combination affects hydration status in older adults. The study found that seniors who consumed lemon water with a pinch of high-quality sea salt showed better hydration markers and reported less dizziness upon standing compared to those drinking plain water or plain lemon water. The mechanism involves the sodium helping retain fluid, while the potassium in lemon supports cellular hydration. For seniors taking diuretic medications or those prone to dehydration, this combination may provide additional hydration support. The optimal ratio based on research is 1/8 teaspoon of sea salt per 12 ounces of lemon water. This provides approximately 300 milligrams of sodium, which is significant for those on sodium-restricted diets and should be discussed with healthcare providers. Beneficial combination #3, lemon water with green tea. This combination leverages the antioxidant synergy between citrus flavonoids and tea catechins. Research published in Antioxidants examined how combining these compounds affects antioxidant status in older adults. The study found that seniors who consumed green tea with lemon showed enhanced absorption of beneficial catechins compared to those drinking green tea alone. Additionally, the combination may provide cognitive benefits. A longitudinal study found that older adults who regularly consumed citrus-enhanced green tea showed slower rates of cognitive decline over a 2-year period compared to controls. The optimal preparation involves brewing green tea at 175 degrees Fahrenheit for 3 minutes, then adding lemon juice after the tea has cooled slightly. This preserves heat-sensitive compounds while maximizing the beneficial interaction between citrus and tea compounds. Implementing these timing strategies requires consideration of individual health status and medications. The most important factor is medication timing, as several common senior medications can be affected by acidic beverages. Proton pump inhibitors, PPIs, used for acid reflux can be significantly affected by lemon water timing. These medications work by reducing stomach acid production, and consuming acidic beverages may counteract their intended effects. Blood-thinning medications like warfarin can have variable absorption when taken with acidic beverages. While small amounts of lemon water are unlikely to cause problems, consistency and timing helps maintain stable medication levels. Thyroid medications are particularly sensitive to stomach pH changes. The standard recommendation is taking thyroid medication on an empty stomach and waiting at least 4 hours before consuming acidic beverages, though individual responses may vary. For seniors with gastroesophageal reflux disease, GERD, lemon water timing becomes more complex. While some people find lemon water helpful for digestion, others may experience increased reflux symptoms. Starting with very dilute lemon water and monitoring individual response is advisable. Kidney function also affects optimal timing strategies. Seniors with decreased kidney function may need to be more cautious about electrolyte-containing combinations and should discuss any changes with their healthcare provider. Implementing these timing strategies requires consideration of individual health status and medications. The most important factor is medication timing, as several common senior medications can be affected by acidic beverages. Create a personalized approach, consult your provider, and track any changes in medication effectiveness or side effects. Creating a personalized lemon water protocol. Start by identifying your current medication schedule and meal timing. Most seniors find success with lemon water consumption first thing in the morning, at least 2 hours before or after medications, and 45 minutes before breakfast. Keep a simple log for the first few weeks, noting how you feel, any changes in medication effectiveness, and digestive comfort. This information helps identify the optimal timing pattern for your individual circumstances. Quality matters as much as timing. Fresh lemon juice provides more vitamin C and beneficial compounds than bottled varieties, which often contain preservatives that may affect absorption. Water quality also affects the overall benefit. Filtered water removes chlorine and other compounds that might interfere with nutrient absorption while providing a cleaner base for the lemon water. Lemon water timing exists within the broader context of hydration needs that change as we age. Kidney function naturally declines, thirst sensation becomes less reliable, and medication effects can alter fluid balance. Understanding these changes helps optimize the role of lemon water in overall health. Research shows that many seniors exist in a state of chronic mild dehydration, which can affect medication absorption, cognitive function, and overall well-being. Properly timed lemon water can contribute to hydration goals while providing additional nutrients. Morning lemon water can serve as a hydration jumpstart after the overnight fast, when many seniors wake up in a mildly dehydrated state. This can be particularly beneficial for those who don't feel thirsty upon waking, or who have difficulty consuming adequate fluids throughout the day. The goal isn't to complicate your morning routine, but to help you make informed decisions based on research conducted specifically with older adults. Small adjustments in timing can help maximize benefits while minimizing potential interactions. Remember that individual responses vary, and what works best for one person may not be optimal for another. The strategies I've shared provide a research-based framework, but your personal experience and healthcare providers' guidance should guide your individual approach. Most importantly, don't let perfect timing prevent you from enjoying the potential benefits of lemon water. Consistency with good enough timing is more beneficial than sporadic consumption with perfect timing. I'd love to hear about your experiences as you implement these timing strategies. Share in the comments below what you've discovered about how lemon water affects you, and whether you've noticed differences with various timing approaches. Your experiences help other members of the Seniors Thrive community make informed decisions about their own routines. The research clearly shows that thoughtful timing can enhance the potential benefits of lemon water while reducing risks for medication interactions and dental health. Subscribe to the Seniors Thrive for more evidence-based strategies for optimizing nutrition in your golden years, and here's to making informed choices that support your health and independence for years to come. I'd love to hear about your experiences as you implement these timing strategies. Share in the comments below what you've discovered about how lemon water affects you, and whether you've noticed differences with various timing approaches.